I'm Susan Michaels-Strasser. I'm the Senior Implementation Director for Human Resources for Health at ICAP at Columbia University in New York City. Join me as I talk to some of my friends and colleagues working in nursing around the world today. In today's podcast episode, we speak to Carole Treston, Executive Director of the Association of Nurses in AIDS Care, or known as ANAC. Carole is a registered nurse who throughout her career has actively championed nurses as leaders in pandemic responses, most notably in the still ongoing HIV pandemic. She has been a member of numerous boards, committees, and organizations related to healthcare, HIV, and social justice, and has presented locally, nationally, and internationally on HIV issues and the important role of nurses in healthcare. Hi, Carole, and welcome. First of all, I'd like to ask you a question. You are leading the charge for nurse protections and leadership in the COVID-19 pandemic, not only in the United States, but around the world. But before we get started, I'm hoping that you would share some of your personal journey with our listeners. We'll start with the beginning. Why and how did you become a nurse?
Well, that's a really interesting question, and I may not give the answer that people expect, but I had experimented with a lot of different avenues when I was a young woman. Went to art school, was a painter, was a history major, was a communications major, trying to find myself in those early years. And one day I was sitting at the kitchen table. I was, probably very early 20s after a couple of false starts, and noticed at the time that there were tons and tons of pages of want ads for nurses. And I thought, well, that's what I'll do. I'll become a nurse. And that truly was my motivator. I'll become a nurse because there's so many jobs for nursing. And I enrolled in nursing school, and I found my home. It worked out. Like, for all the wrong reasons that I chose it, it worked out. It just clicked. It's something I loved from the first week of school. I just loved it. Even before we had patient contact. And again, I chose it for all the wrong reasons, but it worked for me. So.
What a story. But, it's fun to do this podcast because even though we've known each other for quite a long time, I learned something new. And when you're saying that, looking at the newspaper, it showed that you're practical. That you're thoughtful and, really with a lot of common sense, which is what nurses are known for, being very practical, very pragmatic, using their common sense to ensure patient care. So I think there was something working in there as well. And we're so glad that you became a nurse. As a nurse myself, I've seen time and time again in my own career how nurses like us step up during public health emergencies, like COVID-19. Nurses are really the heart of the global health system. In times of crisis, we don't talk about it, we don't ponder, we get to work. I remember during my time as a nurse in Zimbabwe in the 1980s at the beginning of the HIV epidemic. It really was nurses, especially in rural areas, who were shepherding the majority of care and treatment for people with HIV, although we had very little drugs for HIV at that time. But it was nurses who were providing all of the care from delivering babies to taking care of hospitalized patients because there was no doctor there. And really that taught me the power of nurses and nursing to really lead a community through a crisis such as HIV. And it continues to this day where nurses really are, in many cases, the silent leader behind crises and pandemics. I'd like to ask you, what brings you fear and what brings you hope in the current COVID crisis?
Well,
what brings you fear? And then we'll end with hope.
Fear. So the obvious answer, I think, is fear for my fellow nurses in terms of their own safety and well-being.
Mm-hmm.
Making sure that nurses in the US, but probably more direly, if that's a word, direly, in global settings, have the appropriate education around transmission and risk, that they have the proper PPE, and that probably equally important is that they have the proper institutional support for what's needed. Whether that be, maybe making sure that there's appropriate rest periods and shift change, and that there's appropriate staffing, and that there's appropriate beds and appropriate equipment to care for patients. All of that weighs heavily on a nurse. It weighs heavily on all members of the healthcare team, but to care for a patient without the appropriate medications, we or without the appropriate number of ventilators, without the appropriate solutions and other equipment that's needed, is a terrible, terrible stressor for our nursing colleagues.
Definitely.
And what people understand is that nurses need PPE. That's an easy understanding, and that's still a big challenge. It's a challenge in some places in the U.S., but clearly it's a huge challenge in our global settings. But I think that other need for appropriate care, appropriate equipment, appropriate meds weighs heavily on nurses and may not be as easily understood by the general public. That's one of my fears, is that nurses are having to confront that scarcity of all of those things. And one of my hopes about what's happening with nursing in COVID-19 is clearly this has, we talk about the year of the nurse, 2020 being the year of the nurse, and one of the goals of that year of the nurse is shining the light on the many roles of nursing and appreciation for the many contributions that nurses make to global health. When that was devised, it's been this is the culmination of a 3-year campaign. None of us thought that this focus on the role of nurses was what would happen, and this is not exactly what we intended. But clearly, there is now a bigger public understanding of what the role of nurses are, and that's great. However, I hope that is sustained once this pandemic crisis subsides a little bit. I know that we've seen in the U.S. nurses and other members of the healthcare team getting free coffee and lunch and all that, and that's great. That's wonderful, but that's not really what we need, right? We need ongoing recognition for the true science of nursing. That nurses are, data-driven, evidence-based, that nurses use incredible amounts of technology every day, in addition to that human touch and that source of information, that source of comfort and caring that's a critical part of nursing, and how innovative nurses are now providing that within an environment that is not conductive to that. Like, how can you provide that essential part of nursing, human touch, that human interaction, when it must be geared in all this PPE and become looking like a robot or a stranger. So, my hope is that we will continue to elevate the multiple roles of nursing and realize that nursing is complex. It's ongoing. It's not just in this pandemic that, in a year and a half, when some of this has subsided, that this appreciation for the multiple roles of nurses continues.
Thank you. I want to go back to your discussion around your fears, and you talked about how everyone sees PPE as the problem, but there are so many more things, and the examples you gave really speak to health systems and the supporting environment that health workers work in, and we both know the lack of support, the lack of equipment, the lack of infrastructure that nurses work in. I was on a call this morning about a country in West Africa where there is no running water in one of the high care or intensive care maternity units, where women have high blood pressure during pregnancy, which is a very severe condition, life-threatening. And there's no running water there. And just the lack of standards for safeguarding the health workforce, the environment, the equipment, and the support. And I'm really happy that you focused on the support, because often nurses are trained and then go out to peripheral areas and really are on their own in many ways. And I know here in the US, when we work in the hospitals, there's very few doctors at night when we're there at 3 a.m. And so there's often these times when nurses are really bearing the burden of care really on the front lines. And your hopes, it's ironic that 2020 is the year of the nurse, and we have an unprecedented global pandemic, at least in our lifetime. It really is, I don't know, it makes me really think something, I don't know what it is, that these two things came together. And I was so happy, and I know you were, when we heard that WHO declared 2020 the year of the nurse. And exactly what you said, people are seeing now the power of nursing, the importance of nursing. And you talked about recognition. What kind of recognition do you want to see? Obviously, to be appreciated, to be compensated, to be respected. But are there other things, recognition, that you would like to see for nurses?
Sure. So, the Nursing Now campaign is an integral part of leading up to the Year of the Nurse, right? And the Nursing Now campaign, for the listeners, is a 3-year effort, started in the UK, but now is a global effort. And it really revolves around 5 aims. And one of those aims is to have nurses in positions of decision-making. So to get nurses on boards of directors, to get nurses on boards that really determine how a healthcare system will run or how an individual hospital will run. I mean, I think that's really a critical piece, is that, okay, nursing is a big spectrum of roles and responsibilities. The bedside nurse is what most people are familiar with, and we're getting a lot of acknowledgement around that with COVID. But there are also nurse researchers and nurse scientists who do a lot of work around patient reactions and symptom relief to illness. That's an important part that needs to be further acknowledged and recognized, that critical part about nurse scholarship and nurse research. Nurse leadership in terms of decision-making. That's really our legacy, is nurses thinking about healthcare systems and how to make those better, both from infection control as well as a patient perspective. That's what Florence Nightingale did as her initial role. So having nurses on boards of not only leadership around healthcare and hospital systems, but also around organizations and efforts that talk about social justice and human rights. Nurses have an incredible perspective at that intersection between healthcare and human rights. And then finally, having nurses involved in advocacy and health policy. I think that that's another big piece where nurses are underrepresented and under-acknowledged. Clearly in the US, now we have have had some members of Congress who are nurses. Representative Lauren Underwood is the newest of that group. Really bring a unique perspective to that. And clearly in other countries, we've had nurses who are leaders in their government. Sheila Tlo, for example, as the Minister of Health in Botswana comes to mind. But we need more than just a few examples, right? That needs to be a norm, where that perspective, that nursing perspective that's based in evidence and science, but also with an understanding of human rights and social justice and what that means, not only for the individual, but for the large scale public health. That would be my hope, is that when we think about what is the hope that comes out of all this, it's more than just the acknowledgement of the bedside nurse. It's all these other roles that nurses do play and need to play a bigger role in.
One of our colleagues, I'm forgetting her name right now, but she has that quote that it's very important to have nurses on boards and in leadership positions, because nurses are the reality check in the room. Yeah. And I really love that. And it really goes back to what you said about becoming a nurse, that common sense, that practicality, that reality check that keeps us centered on what is most important, which is saving lives, helping patients. And I really like that you brought out the social justice and the public health focus of nurses. In addition to Florence Nightingale's work, and her legacy endures to today, as we all know. And my hero really is Lillian Wald, who was a nurse and really a pioneer here in New York City, helping people in the tenement houses at the turn of the 20th century, dealing with tuberculosis and cholera and diseases of poverty and poor environmental conditions. And she did so many things, was such a powerful leader, and started the visiting nurse service, which is now a model throughout the world. And, if there are young nurses listening to this, we have tremendous legacy out there of women and men doing exactly what Carole just said, fighting at the bedside for high quality patient care, and also fighting for justice and healthcare for everyone, and to look not only as health as an individual issue, but as a social issue as well. Thanks for that, Carole. I want to now talk about
something in here about that, and
sure,
what in particular what COVID-19 has brought to the surface. And COVID-19 has brought to the surface something that many of us in healthcare have been familiar with and talking about for years, but this has brought it out to a much bigger audience, is racial disparities in outcomes. And clearly we're seeing, horrible outcomes in African-American people, in Latino people, and in Native populations in terms of outcomes. And there's a lot of reasons for that, right? Some of it has to do with pre-existing conditions. Some of it has to do with access to healthcare, and other complicated factors like trust and mistrust in the healthcare system, language and cultural competency. And I think this is another role where nurses really can show the way forward going in the future. And that is really talking about racial disparities in health outcomes, whether it starts with COVID or we talk about other disease entities or life expectancy. And that's a tremendous role for our nurse colleagues, and in particular, our nurse colleagues of color or nurse colleagues from the communities that are suffering from disparities. We now have that opportunity to leverage this attention that COVID-19 is bringing that to the way forward. And I think that's going to be a great role for nurses. And it involves, of course, social justice, social determinants of health, and human rights, and healthcare as a human right.
100%. And you're a global HIV expert. Can you say a little bit more about the parallels between fighting HIV in the late 80s and 90s and now what you are seeing, this disparity around the COVID-19 outbreak? Can you talk about some of the parallels that you see?
Sure. So I think there's parallels and similarities and then differences too. And I'll talk about the parallels and the similarities first. Clearly, it's an infectious, both HIV and coronavirus or SARS-CoV-2 are infectious diseases that came upon the scene without any real understanding about their transmission or their risk to healthcare providers. And in both cases, nurses stepped up and cared for patients and are caring for patients in a very patient-centered way, despite unknown risk to themselves and also, unfortunately, stigma that's associated with HIV and continues to be associated. And there is some stigma that we're starting to see around, unfortunately, around not only COVID patients, but stigma around nurses who are caring for COVID patients. We hear these stories around people who are outside in their scrubs being verbally attacked. It's just is unbelievable. In both COVID and HIV, nurses stepped up and cared for the dying in ways sometimes when other people couldn't, right? So clearly with HIV, nurses stepped up and were often present at that transition when biological families would not be present because they of crazy, disowning. And now in COVID, nurses are walking that final path with patients because of hospital restrictions. So again, nurses tending to patients who are dying, and that's an area that nurses do and excel at, right? That is part of our journey and our expertise. I will say, though, there are differences that are really acute. One is, of course, COVID-19 rapidly ramped up, right? This surge of patients, this total across the board surge and high numbers was unanticipated and unexperienced, and we haven't experienced anything like that in the past. Nurses having to wear those PPE suits that are protective, but at the same time create a barrier between the patient and the nurse. While in HIV care, that ability for nurses to touch patients when no one else would touch them was one of the most important parts of our care for people. You know, that we didn't wear all that gear, that we touched patients and we cared for them in a very human and therapeutic way. So I do think that there's some similarities in terms of how nurses are stepping up and are thinking about innovative ways to care for patients. When you talked earlier about, you know, why nurses need to be at tables of decision making, is because we are the implementers, right?
Exactly.
In the early days of HIV and AIDS, it was nurses who understood that we need to do comprehensive care, that we need to think about nutrition, and we need to think about wellness and psychiatric care, and we need to think about substance use treatment and other parts of the whole person, and that nurses now in COVID-19 are thinking about how can we, even with the restrictions, think about that whole person, even if it means getting on an iPad with a family member, right? Other innovative solutions like putting those big IV trees, you know, those big multi-fold out in the hallway so that we're not so much cross-contamination. So once again, nurses are thinking about innovative ways to implement the care that's being required despite challenges. The challenges are different, but it's still the same in the sense that nurses are thinking of ways to solve some of these challenges.
Beautifully said. I'd like to now ask you, drawing from your own experience, what can decision makers and leaders in public health systems do to care for their nurses and draw from their experience as leaders in emergencies like COVID-19 and HIV?
That's a really loaded question. You know, I think one of the things that this is exposing is that our healthcare system in the U.S. Is run with such slim margins, right? It's on an as-needed basis. Things are stocked on a, what is that term?
Just-in-time procurement. Yeah.
You know, a hospital's not successfully run unless it has no empty beds, right? That's either admit, or you shut down a ward, a unit if you. And the risk of that we're experiencing now, right? That with not having any wiggle room, that really, particularly in this decade that's to come, where we're going to have more emerging threats and emerging infectious diseases. So thinking about our healthcare system as an acute money-making machine, and not as a public health mechanism, is wrong. And I think that will be part of something that we need to learn from this going forward. The other part that I was hoping we had learned through Ebola, but apparently not. Yeah. Our health systems are really global, right? And so our borders are porous as people travel and as more and more of our economy is multinational and cross-global. And I really cringe at thinking about that in our new environment of isolationism, right? And how some in the U.S. are thinking about U.S. as an isolated entity, right? Closing borders. And I don't mean closing borders due to COVID influx. I mean in general, right. A separate entity, and not thinking about our role as a member of the global health community. You know, when we hear recently about WHO funding being withheld and how that instead should actually be increased because we are all part of a global health system. Yeah. So I think there's a lot of faults that COVID-19 is exposing, and what do we do with this, and how do we learn from it going forward? Because this is not going to be a one and done episode with how we exist in a global public health setting. And so how can we lead by example in having healthcare systems that are more public health oriented? Or probably more likely, how can we learn from others? I'm thinking National Health Service. I'm thinking other countries in Africa that have more of a tertiary and healthcare system that's built. How can we learn from the Cuban health system, for example? How do we think about healthcare in a different way that's not all about revenue generating and that as the driving force is going to be important in the next decade.
That primary health care or preventive health care is so important. And you and I, working internationally, have seen that. I have seen the power of that at work. And we have seen the power of systems that are integrated and have surge capacity, because we do this all the time for HIV globally, where we have so many people on antiretroviral therapy and they cannot skip a dose. And so our supply chains are locked tight and exactly, I mean, I knew there were fault lines in our health system and this patchwork of private and public hospitals but the depth of that and the ramifications of it are so acute and so profound. We have reached 100,000 deaths from COVID-19 in the United States. We have more cases and more deaths than any country in the world. And there's a lot of things that the U.S. is very proud to be first in, but this is definitely not one of them. And I hope people listening to this podcast join you and join me in working to lead development of a stronger, a more just, a more effective, more efficient, more cost-effective health system that really drives health for people. Mm-hmm. I really want to thank you, Carole, for sharing your insights, your history, and talking about two such important topics, HIV, which we, as you said, are still grappling with today. But through your commitment and many others like you, we now see HIV cared for as a very manageable chronic disease. And I want to end by saying, you talked about the universe and how we are a global community and how connected we are. And it's so true. I mean, this virus spread like wildfire across the world. And an infectious threat anywhere is a threat everywhere. And there isn't a border to stop that. There cannot be a border to stop that. Viruses are their own beings. And as we've seen, they get more and more clever. And so we need to get smarter, more united as a global community to address these threats. So thank you again, Carole, for taking the time. I know you're very busy, and for sharing some of your insights and thoughts with us.
Thank you for inviting me. And I really hope that as we move forward over the next months and years, that we really take the lessons of this pandemic to heart and collectively make change grow.
Thank you. Thank you all for listening to this podcast. This year, as you know, is the year of the nurse and the midwife. As we celebrate the nurses and midwives in our individual lives, our communities, and our world, it is time to focus in on what matters. By building more resilient and well-trained frontline health workers, health systems will be strengthened not only in the course of normal operations, but most importantly, in times of crisis. Thank you.